For a lot of our patients, it is important that we do proper STI screenings, and that includes HPV. This is something that I remember when I was growing up. This was something new for me, so it can be still new for our patients and their families. It's something that not a lot of people are agreeable to, so the education that has to be provided to them on the importance of it, the safety of it, and the longevity of protecting their family members is crucial. What a lot of people don't know is that HPV is actually the most common sexually transmitted virus in the United States. About 240 million people actively have the virus, while 5.5 million new cases in sexually active men and women are recorded each year. With that rapid of a rate of transmission, it is believed that every person at some point in their life is going to contract HPV. So, the importance that you can stress to your patients is that at some point, this may affect you and your loved one, and let's protect you from the ones that can cause cancer and can be really detrimental to your health. So, an important factor that we want to stress is that this virus in particular is commonly known as the silent virus. That is because it can lie dormant in your body for multiple years. It may not affect you until you're in your late 30s or 40s. So, in order to protect your loved ones, it is important to get them protected before they even have sexual intercourse or sexual actions. As we all know, sexual education varies across the country. It can be because the school system doesn't provide it anymore, the parents don't want the school to provide that information to them, and they want to guide that conversation on their own at home. So it's imperative that as a provider that we show up for them and we give them proper education. So not only is it important to let them know how easily contractable it is, but how it's contracted. It is a skin-to-skin contact. It does not always require what we commonly think of sexual acts to get it. However, the cancer-causing strands do require deep penetration in order to get to the cervix, for the cervix to then to anchor into the cervix and potentiate that risk for cancer. There are 3 different types of HPV. There is the mucosal genitalia, and then there is the non-mucosal cutaneous. So the mucosal genitalia is broken into 2. It is the high-risk strands and the low-risk strands. The high-risk strands are the ones that you want to monitor closely. Those are the ones that potentially develop into cancer. Those can require procedures, frequent pap smears, and that kind of treatment. The low strand are typically just watched during each of your pap smears. Less likely to develop into cancer, but you still want to keep an eye on them. The non-mucosal cutaneous ones are warts, and those can be found anywhere on your hands, your feet, sometimes around your genitalia, or your anal area. The patient population that we are focusing primarily on are those that are of minor age or young adults. So anywhere between 11 to 18 is usually where we're having this conversation. So a lot of the times the parents are making the decisions on yes or no with the protection, and sometimes we are able to get to an age range where the patients are making decisions for themselves. Should your family decide to get on board with the vaccine, it is provided in either 2 to 3 doses, depending on the patient's age and any pre-existing conditions that are listed under the CDC's website. Something that puts our families at ease is that it is a generally well-tolerated vaccine. The most common side effect is that there's some redness at the injection site. As with all vaccines, though, there are some contraindications. So anybody who has a hypersensitivity to yeast, anybody who has had an allergic reaction to the first dose or the second dose would not be appropriate to give the second or third dose to. If you are currently pregnant, or if you have a latex allergy. Let's do some facts and fiction. There is a worry and a misconception among those who get the non-mucosal cutaneous strands that if their warts are not treated, that they will develop into cancer, and that is simply a myth. Myth. The vaccine has now been developed into covering men and women ages 9 to 45. Myth. You do not have to be sexually active in order to get this vaccine. It is important to note that this is a preventative measure, so it's never too early to protect your future self. Myth. HPV does not only cause cervical cancer, it can cause oropharyngeal, rectal, and other genital cancers. There's also a myth that if you get the vaccine, then you don't have to have proper follow-ups and care outside of that, which is untrue. The vaccine protects against about 70% of the strands that are out and about. The other 30% are only detectable by pap smears. So we do encourage, per the CDC guidelines, depending on your age, you get those pap smears and those screenings as often as it is recommended. These conversations can be hard to have, they can be uncomfortable, so it is important that if you do come across those patients who don't really want to talk about it right now, that you do have pamphlets, links to YouTube, anything that is accessible to them and information that makes the most sense to them, you can provide that to them so they can maybe go home and make that decision as a family outside of the office setting. With Gardasil, you could be one less.